Hi, my name is Dr. Brian Burr. I'm a chiropractor here at Complete Chiropractic in Allentown, Pennsylvania. Today we're going to be talking about back pain, the types of back pain, and the causes of back pain. First, we want to talk about prevalence. Will it happen to you? 1/2 of all working Americans report back pain at some point in each year, and 80% of people will have a back pain issue at some point in life. It is one of the most common causes of missed work, and it's the second most common reason for a doctor's visit. So first we want to talk about the structures of the back. Right here we have an example of the spine. Spine is the main component of the back. You'll see the bones of the spine are called vertebrae. In between these, right in here, you'll see an intervertebral disc. These discs are made up of two different substances. The outer substance, there's many different layers. It's called the annulus fibrosus. It's a fibrous layer after layer after layer. And the inner substance is the nucleus pulposus, which is a gel-like substance. The disc will act like a shock absorber, dissipating the forces out. Other things that we have to talk about is the ligaments, which we don't have here, but the ligaments will help support and stabilize the joints to prevent excessive motion. And then the muscles. There are two types of muscles: the small muscles, which will help stabilize, and then the larger muscles, which will help with gross movement. Another thing we have to talk about when we're talking about the spine is the nervous system. One of the functions of the spine is actually to protect the spinal cord, which is in here. I don't know if you can see that. And the spinal cord will give out the spinal nerves, which are the yellow things right here, which control basically every function of your body. So, different types of low back pain. There are many different forms. Disc herniation is one type that we'll talk about today. Disc herniation is where you're having tearing of the outer fibrous layer. If you have enough tearing, then the gel-like substance pushes out backwards, causes some issues with that. Occasionally can push directly on the nerve. More often it's just the irritation of the nerve. Muscle sprains and strains. If you're picking up something too heavy, something has to give, you can do a muscle sprain or ligament strain. Another thing that we're going to talk about is sciatica real quick. Sciatica isn't really a direct type of back pain. It's a general terminology. Sciatica just means any pain going down the leg, going down the sciatic nerve. Any irritation to that can cause sciatica. So a disc herniation irritating the nerve can cause sciatica. A muscle sprain irritating nerve can cause sciatica, as well as other issues can cause some sciatica as well. Degenerative disc disease. Degenerative disc disease is where that disc, that gel-like substance in the center, actually dries up, and you're having a flattening of the disc, which can lead to some excess motion and some other issues. Along with that, some arthritis. Arthritis is the wearing down of the cartilage, protective layer, and bone of the joint, as well as getting some inflammation in the actual joint. So different risk factors for the back pain: repetition, continuously doing the same motion without rest will fatigue the muscles, can lead to some injury. Force, again, picking up something too heavy, something has to give, and that's a structure that's probably going to cause some back problems. Awkward posture. Awkward posture means that you're not having correct biomechanics, you're not going to have proper movement. So say you pick up something with your back instead of your legs, you're putting more force actually on your back, can lead to to some issues with that, as well as static posture. If you're in one spot for too long, your muscles will tire out and cause some fatigue, increased chance of injury. Your weight as well. If you're carrying 50 pounds with you all day, every day, your muscles will fatigue more easily. Temperature extremes. Temperature extremes is where, and say it's cold out, your muscles aren't as pliable. You try to do something that you could normally do, however, muscles are tight, and it can lead to some injuries. Vibration is another thing that not everybody thinks about. Short-term vibration, like the vibratory massage, can be great. However, over a long period of time, vibration will actually break down different tissues. And then psychosocial effects. If you're happy with your job, you're going to have less risk of injury. If you hate your job, you're going to have more risk of injury. That's just the emotional influence of your health. So repetitive trauma, you're breaking down that outer fibrous layer, one layer at a time. Finally, it's the straw that broke the camel's back, and the last layer breaks, and the nucleus pulposus comes out. You have severe back problems. Other things is just one large movement that we talked about can cause muscle strains, ligament sprains, and other injuries. Overuse, static posture, poor ergonomics, and then improper biomechanics is also an issue where one area is stronger than the other area. Say your quads are stronger than your hamstrings, which are weak and tight, can cause actually some low back problems and some knee problems as well. I know we went over this very quickly, so if you have any questions or need any more information, please contact me at info@completechirocenter.com or visit our website at www.completechirocenter.com. Thank you.